And this is Andrew, and I am about 3 weeks post-op and 8 months on T. Um, I haven't made a video in a really long time, and I've been crazy with work, and I really regret that, but I'm making one now. So, a lot of big updates. I had top surgery by Dr. Fischer. I had a double incision with nipple graft top surgery um, on December 4th in Timona, Maryland. And everything's gone really great. It's been a really great recovery. Today is my first day not wearing my surgical binder. So that's really exciting because for the last 3 weeks, even though I don't have a chest, I've still been having to wear this big surgical binder with all this padding in it. So it was hard to tell the difference between the binders I was always wearing and the surgical vest. So that a lot has changed. Like, I've gotten surgery now, and it's awesome. I really can't wait till I don't have steri strips and tape and stitches in me, and so I'm very excited for that. But it still feels so different to wear a shirt, and that's awesome. Body-wise, my voice has dropped dramatically, and I've really realized that because I've had to go home a bunch. I was home for 2 weeks for surgery, and then after 2 weeks at home, I saw a lot of people that I knew before and that I haven't seen in the last year and a half. And I've very dramatically changed. My voice is really different, and so is my face and the rest of my body. So it's different. It's difficult sometimes. I think that surgery is somewhat glorified in the trans community, and not that I would regret surgery at all. I'm the happiest I can ever be in my whole life. Feeling that I can look down and look at my body, and it is the way that I see it. It's the way that I've always imagined it. But getting reconstructive surgery is tough on your body. And especially, I suffer from depression and have my whole life, and to be contained in your parents' house for 2 weeks, and as supportive as my parents are, it was tough for me to really have to sit still and not move for 2 weeks, and it really triggered a lot of depressive episodes for me. And so that was hard, and now I am back to work. I'm a preschool teacher, and I teach after school with 2nd through 5th graders. So my job is very physical and very laboring, and so that's been hard coming back, and I definitely have some swelling to show for it. But it feels so good to be back doing what I love to do with a body that feels more apt for what I'm doing. It's great. Other body changes, my belly and chest and arms have gotten a lot hairier. My chin and the rest of my face has gotten much hairier, so my shaving is becoming much more regulated. Still not there. Still not in a place where I need to shave every day, or even a place where I could grow out and grow a beard right now without looking pretty haggard for the first couple weeks. And since I teach every day, that is not an option. It's been a really interesting 3 months for me. And I think I know in this video I'm totally bouncing around from topic to topic, but that's just how it's been for me. I have this one part of my life where I go and I teach, and I'm Andrew Miller, and that's all they know me as, and I'm a guy, and I think a majority of them see me as a cisgendered man. And then this other part of my community back here in Boston, everyone knew me pre-transition, so they see me more as a trans man. And for the first time ever, that's hard for me. It would be a lot easier to just be a normal guy, to be a cisgendered man. But that's not how I was born. And so I'm really kind of having to balance how I feel about that and how my trans identity affects me and who I am. It's definitely become a lot more real the more I pass, and without, I mean, when I wore a binder, it gets you flat chested, but I was large enough that it never truly made me pass, and I pass a lot more now. So it's different, and it's better, but it definitely triggers that ability to want to stay in the place where no one knew you before. So it would be a lot easier for me to just pick up and move somewhere else, where everyone only knows me as Andrew. But I guess that's just part of transitioning. Another big step, well, not a big step, but I had a really good experience with Dr. Fischer from Pomona, Maryland. She was really great, did a really great job, and it was really great with recovery with me. I guess I'll show everyone my chest now. I have scar strips on them right now for healing my scars and everything, but I'll show it anyway. So I put gauze over my nipples because the scabs were healing, and I wanted to let them heal. So on here, so these are all little scar strips I'm taking off. They're little jelly strips. Right here I still have steri strips on from surgery, but these lighter colored ones are gel strips, and they're to help the healing process of my scars. And I have my big one right here. So there we go. That shows you the back side. So this is what I'm working with. This is my chest. I'll stand up. So everything's still recovering. I am pretty sure I'm gonna have a dog tag here, a dog ear here. I have a small amount of swelling right here, which is the most swelling I have is here and here. As you can see, that goes all the way around. She likes to cut high. Dr. Fischer likes to cut high because then once the scars heal, it makes a nice contour for pec muscles. On the tips of my nipple, you can see I still have my scabs. It's all still scabbing over. But essentially, I think it looks really good. I really like how small her lines are. I think they heal nicely and will look like a good chest. As you can tell, when I bend down, you can see this swelling here. And I went to my doctor here in Boston to check to see if it was a seroma or not. And she said it was too small to be a seroma, but to keep an eye if it gets bigger. So I think I'm going to go in like 2 weeks if it's still there. You know, it's cool. Like, it's still interesting to feel down and feel my own chest and not have giant lumps there. I mean, I can't describe it. It still is one of those things where, like, it doesn't feel real yet. And I'm still so worried about everything that could go wrong. But it's really amazing. Today was my first day to put on a sweater and like a shirt and not have to wear a binder or anything on it. And that, I mean, that was awesome. It was mind-blowing. And you know, I've been really privileged to have a family that now really supports me and that is coming around, and have friends and a job that respect me for who I am. But it's been a long journey, and there's still a long way to go. But I'm really proud of the progress I've made and the steps I've taken. And you know, I wouldn't really want to have it any other way. Because so many things I've looked back on, I'm proud that I've done them, even if they weren't even if they were painful at the time, they're worth it in the end. And I think transitioning to become the person I really am, the man I really am, is probably one of the best life decisions I've ever made. So I'm really happy. So I will promise that I will make another video sooner than the delay caused in this last one. So everyone have a good night and have a good new year.